Between 6 to 8 months, we still promote our hands and feet play so the child can learn to explore their toes and their ankles, their midfoot. You may see they start to be successful more frequently at actually grasping both feet and simultaneously rocking side to side. The rocking component will be highly influential for eventually, whoops, accidentally going onto their side and eventually onto their belly. So it's a huge milestone for rolling, and the type of rolling that will be done is called non-segmental rolling. So their whole spine moves as a unit and they go onto their side. Eventually we want to do some more mature pattern of rolling, and we'll do that by doing a segmental roll. And what that'll look like is the child's leg will be maneuvered up and over while the chest or the shoulder stays down, and so we have the hips move forward and then the chest follows. But at the very first 6-ish months, we should really start to see more of this style roll, and then closer towards that end of the 8 months, we should see a nice segmental roll going from supine to prone. The child should be, by 8 months, fully rolling 360 degrees bilaterally. The next thing we want to revisit is how our child is doing in supported sitting. We can get a little more aggressive with our earlier mentioned side-to-side and forward and backwards leaning activities, decreasing our level of support down to the hips rather than up high at the shoulders. With sitting, we can also start to introduce practice on a wedge, so where they're facing downhill, and we can reverse it to where they're facing uphill. If you don't have a wedge in your home, like a formal wedge, you can use a stack of pillows. You can use, if your child is still small enough, your own thighs in this fashion here. You can get a little more aggressive with the yoga ball and how fast or quickly you're making them require a response for righting themselves in space. For sitting and scooting too, we can get a little more creative. We can have them on a scooter board and we can roll them around. Bear in mind that a scooter board doesn't have sidewalls, so they might be doing that closer towards that 8-month marker versus a diaper box, for example, would have nice high walls that they can rest their arms or their hands on, so that way when you're pushing them around, they're able to have some sort of security or support. If you want to reduce the level of support for the diaper box, you can cut the edges to make it lower and lower down until you progress to that scooter board eventually. When it comes to protective extension, at the 6 to 7-ish month period, we start to see a forward protective extension to brace a forward fall. And then at the 8 to 9 month period, we start to see the hands go laterally for a lateral protective extension. During the 6 to 8 month period, though, we would not anticipate a backwards protective extension. This doesn't normally happen until that year marker, or 10 to 11 months to be more precise. We also want to facilitate each of these initially by hand over hand, if at first we're not seeing the child perform it independently as a reflexive response. So at least we can kind of get them geared towards doing more of a learned, slower behavioral response. And I say slower just because that learned response won't be as quick as the infantile, the pediatric reflexive response itself. More dynamic weight shifts are something we'll also visit, going back to our earlier milestones for quadruped positioning. So when they're on their hands and knees here, we might start to see them shifting left and right, maybe even wobbling forwards and backwards onto nice extended elbows in this position here. We can even give them little nudges or perturbations to kind of try and tip them out of position, and they resist to stay upright. Fluctuating between going down on their chest and then lifting up onto straightened arms is another beautiful activity to promote. And then we can rock their hips to eventually get them to a nice kneel. And they can kind of play around in this short kneel where their ankles are rested onto their heels. Or we can advance it into a tall kneel where they lift completely off their heels and their butt is in space. And they can do this at a low-seated couch or a box with maybe colored pencils or crayons, markers, you name it. And then they can practice on really firing the glutes in this position here. And to demonstrate, so we have a short kneel in this fashion, and then we have a tall kneel in this fashion here, keeping in mind that my glutes are much more active here versus here. With the positioning of the child, we do want to also get more into transitions in and out of one position and into another. The most common that we can do from sitting is a transition into side sitting. And all we do, if I want my child to side sit facing their left, I will just grab their right knee and I will rock it up and over, and I will help shift their body to face a little bit leftwards. I'd like them to have nice outstretched arms, but what this looks like for me, if I were the child, I would start in this position here, and then the provider, whether it's a clinician or caregiver, would rotate that knee, and then I hope that the child will rotate their chest by themselves, but if not, you may have to give a little bit of an assistance, and that's just to reduce the tension on this top hip if their chest is like this. And if you were to do it yourself, you can feel it's a little bit uncomfortable deep in that joint. So it looks like this, and then they shift over. And then from here, we can get them to practice going into a quadruped position by grabbing their hips and rainbow arcing up and over. And so what that will look like is this, and they'll be responsible for moving this foot here into place, and we are in a nice quadruped position. From here, we can rainbow arc their hip down and across, and they will fall into a nice side sit here, and we'll just control this top knee and bring them back into a ring sit or a circle sit. So all together, it looks like this. I'm rotating this over, my chest rotates, and then I can lift up into this position here, and I'm in quadruped. In quadruped, we can practice those forward and backwards, side to side weight shifts. And if we want to advance them to a crawl, we can grab an ankle or a shin and we can drift it forward while simultaneously weight shifting. So from this view, I have a side shifting this way. So this is easier to move for the child and for you. And then you'll drift forward. And then I can shift the other direction and manipulate the other knee. A true reciprocal crawl may not happen until those later 8 to 9 months, but for now we're just trying to get them accustomed to the idea of moving in that fashion. And so for this child, it may look like this. If they need more assistance, you can grab their hip bones bilaterally, and you can wrap your fingers behind their bottom, and like this, and you can guide by pushing this way with the pinky into the back of their thigh, driving it forward while simultaneously weight shifting. This is very dramatic, but that'll hopefully give you an idea of one other facilitation technique. Now, they are responsible for moving their hands. Now, let's say you have a child that doesn't actually engage their upper extremities at all. What you can do is a wheelbarrow, and to do that, you can lean them here, and they support their weight on outstretched hands, and you can just guide them forward, guide them backwards, and they're responsible for keeping up with their hands. You can do this too at the edge of a couch. I would recommend that you either kneel or stand, and then you float their hips, and they are responsible for walking on their hands. Let's say you have a child who the hands are no problem, but the legs do not move at all. You can cause them to give themselves a big bear hug, hold their shoulders, and then have them try to move their knees towards you one at a time as you just gently guide them forward towards you. You may want to do a little bit of that rotation so it weight shifts them contralaterally to the limb that they would advance, and you can do it in this fashion too. Once they learn one component and then go for the other component, they should have an easier time to piece it all together, only if the lesser form or the more simplistic form is just not coming along for that child. Supported standing is something that often confuses individuals. At 2 months, you might note that your child can stand with their back against a wall, and you may have decided, let's practice lots and lots of standing so they can walk soon. Well, it's not until this maybe 6 or 7 month period where the hip sockets are just a smidge deeper. They're not fully formed by any means, but they're not completely flat either. Like they might be at 2 months, where a hip dislocation or a subluxation or relocation may be more prevalent. So now that their ligaments are also a little bit more shortened and a little bit more tight, which is ideal for the integrity of those hips, we can work on practicing in this stand or supported stand for a little bit longer. Initially, I might be up at the armpits, and then I can creep down, 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 down to make it harder for them until I'm at the hips. I can then go to the hands and have them practice with my hands completely stationary, or I can wiggle my hands to give them a lesser sense of support, so they have to do more to stay upright. I don't really weight shift yet in standing in this fashion, just because I would like to wait just a little bit longer for those hips to mold a bit more, maybe about the 9 month period when they're starting to cruise along furniture. It might be a bit more conducive, but this 6 to 8 months, maybe prioritize static standing for prolonged periods over dynamic standing. Another activity we want to introduce, sit to standing becomes more and more important. You can do it on your lap here, and you can give a little bit of a nudge into their armpits going upwards, and it may elicit a standing reaction. If that doesn't work, you can give a little bit of assist. I wouldn't recommend so much grabbing at the hips, or sorry, at the chest, circumferentially speaking. Do a little bit of a backwards lean, and then go forward, and with a good hold on their hips, nudge them forward, and that may elicit a standing reaction if the armpit slight pressure into the skin upwards doesn't elicit the stand. If neither of those are working, go ahead and just control at the hips and guide them up and forward. More so forward. I want them to do the up on their own. For coming down, we just gently pull them backwards back into our lap. Let's say your child really, really wants to face you. Each time you do this, they keep turning to look at you. Then instead, go ahead and sit them on a low-set stool or a box, and then you can hold their hands and guide them up and towards you, or you can go under their armpits and help guide them in this fashion here. I normally like to do the backwards one versus forward variant, because the forward variant, I typically see that babies have a little less control and they just either fall straight into you, or you might have to use a little more hand assistance or manual assistance lifting them up versus just tilting them forward away from the surface. So hopefully you found that helpful for 6 to 8 month kiddos.